I would 100% recommend health and international development. I've always had an interest in international development, and then when I was working as a social worker in the field of sexual and reproductive health, I realized that this program was perfect to kind of combine my two worlds.
This course is really relevant for intercalating medical students because it really helps bridge the gap between practical experience and theory when it comes to understanding how health systems work.
So currently I'm working part-time with individuals experiencing rough sleeping who may have complex needs alongside being a part-time student, and I think I've actually experienced a real benefit from trying to translate some of what I'm learning about the theory into my everyday practice.
Being a medical student, I wanted to pursue something in healthcare, but at the same time I had aspirations to better understand the links between health, wealth and development, so for me it was just the obvious choice. You often think, what impact can I have as a doctor? You can only see so many people. So if you want to truly do something transformative that may impact a great number of lives across continents, then really you have to not just take that medical viewpoint and expertise, but apply it in it with the learnings that come from international development.
What makes this program unique is that by thinking about health in a Department of International Development, we're really situating health in its context. We're thinking about how do health and international development impact each other.
Our department is consistently ranked in the top 5 for international development in the world. And that is because I think we train our students to have an interdisciplinary perspective, to understand why things happen in our world, why there are health inequalities, and to start to develop solutions to those really difficult problems.
Health is political. Health is science, health is social. You cannot approach disease or health problems from one perspective only.
His students come from probably the most diverse set of backgrounds of any MSc course that we have in the department, because we get students who come with professional backgrounds in health policy, doctors, nurses, biomedical sciences, just straight up development studies students, people who come from the NGO community, the private sector. We get people who come from government. So it's an extraordinary range of students and talents.
Professors take a multidisciplinary approach. They encourage you to see how these things are linked back to pivotal historical moments or different systemic processes. And the deeper you go into the root causes of things, the more likely you are to actually make tangible change.
Being able to think critically and really analyse all these different perspectives is really interesting. That is what has excited me the most with this course.
I would say that the LSE attracts the brightest and the best students from around the world. On average, in our programme, we have students from around 40 different countries.
And this is why it's so exciting to see how peer learning happens across such a diverse group of students. Students get to engage with somebody who has come from a clinical background, alongside somebody who's come from a consulting background, somebody who's come from an economics background, and bringing these really diverse perspectives to bear.
I've met so many different people from different backgrounds, and it's been really interesting to learn about where they've come from, what they're looking to do, and that's kind of inspired me in my own career prospects.
Clearly the LSE name opens doors, and the HID degree certainly opens doors as well, because it gives you a special set of skills that I think increasingly in the world is recognizing.
Having that master's degree from LSE is just such a bonus. You're able to demonstrate that you've gone to an institution that encourages you to strive to be the best. Because that's what LSE does, is it puts you under pressure, but in a good way. And you have to learn a lot of content in a very short space of time. And for me, I love that. And it forms and shapes you into a particular individual that I think is highly attractive to all sorts of companies and organizations.
Around 90% of our students are in employment in really high caliber careers.
And we've seen them going through international organizations, to national health services, to ministries, to NGOs. So one of the great things is the network that is also created by the students.
After graduating from LSE, I started working in a consulting firm for healthcare. Graduating from LSE really opens doors. It has paved the way to the job I have now because it is really a stamp of quality.
I'm a doctor by background, but I am now the medical director and co-founder of Apian, a healthcare drone logistics startup. I'm originally from Afghanistan, and so drones have been on my mind for the very wrong reasons ever since I was a kid. So I'd always think about this sophisticated technology and why we couldn't use that tech to, instead of delivering bombs, but deliver blood instead for our NHS and our patients and people around the world. It's not just blood, it's vaccines, it's medicines.
It's really exciting each year to see how students learn from each other, learn from faculty, and to watch people's journeys so that when they leave the LSE, they're really confident in the skills that they are taking onto their next post.
I think it's really opened my eyes to what's available to me. So it's not just the clinical aspect now that I'm interested in, but also policy making, but also maybe outside of this country, working across the globe.
I would absolutely recommend the HID course for anybody. The program's definitely giving me many of the tools to take the next step.
Some people may think that development is a bit of a doom and gloom situation, but I am very optimistic that things like technology and entrepreneurship will be the winning things that make a difference. And what I would say to anyone who has got a burning passion inside of them to make a difference, take that energy, run with it. And I really think that that is what's going to change the world.
I really felt like I had a lot of imposter syndrome because I'm not an expert in health, but it's been really transformative. The cohort that I've kind of become very close to at LSE has really become family for me because we've all gone through a very unique experience together. And I think that bond is so special that only the people that have gone through it will be able to understand it.